Hello friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to talk about chapter number 6, that is all about the human identification, my dear friends. So, human identification, the factors needed to prove a crime would be the dead body obviously, would be the weapon which is used to kill the person, would be the crime scene, would be the stain or the cloth, my dear friends. So, these are the different factors which are needed to prove the crime. And for that, we need to identify also the human. Whose dead body was there? Male, female, child, adult, old age, what type of weapon, where crime happened. All those things we need to study under this heading, human identification. My dear friends, identifying method. If I talk about the number one method, that is called as what, sir, here? Poroscopy. So, pore itself is suggesting you something. Poroscopy words mean studying of skin pores. So, studying of skin pore is called as poroscopy. There will be what's here? Sweat gland arrangements. And sweat glands are arranged in the pores. Discovery was done by Edmund Locard. And sir, in 1 mm of the ridge, 9 to 18 pores are present. What is the shape of pore? Pores can be squarish pore, can be oval pore, can be the round pore. So these are the ridges. You can see these are the ridges. These are the black one are the ridges and the holes inside them are the pores. So study of pore is called as poroscopy. And remember guys, next, cilioscopy. Study of lip print is called as cilioscopy. Discovery was done by Suzuki. And stains which are used to study the lip printing is aquaprint and cyanoacrylate. Aquaprint and cyanoacrylate. Aquaprint and cyanoacrylate. Study of lip print, cilioscopy. Discovery was done by Suzuki, and the stain which we like lip printing. You will see right here, sir, the pattern of lip we have to read, my dear friends, right here. So pattern of lip, if you see, the number one is reticular pattern. If you observe this pattern is like the sieve-like pattern. This type of pattern is called as reticular pattern. Second type of pattern, if you see, sir, right here, sir, vertical type of pattern. You will see vertical lines are here, sir. If you kiss someone, you will see the mark over there, lipstick mark over there. My dear friends, vertical pattern. Third type is intersected pattern. They are intersected like this. The third type of pattern would be intersected pattern, my dear friends. Then fourth type of pattern would be branched like this. Branching. There will be branching like this. Branched pattern. And fifth type is partial vertical pattern. Partial vertical. The 5 important type of pattern you are going to see in the cilioscopy, my dear friends. And the dye which is used would be the aquaprint and cyanoacrylate. Now coming to the palatography, the third type of study would be what's here? Palatography. If we see palatography, the palatography is also called as rugorography. If you put your finger inside the mouth, you will see the anterior 1/3 part is the hard palate and posterior 2/3 is soft palate. And the classification was given by Allen, my dear friends. This classification was given by Allen, my dear friends. Coming to the next is superimposition technique. This is only screening test, not a confirmatory test. If you can see here what is happening, you will take a photo. Step 1, you need a skull and the photo. Step 2, enlarged and superimposition. Third is anatomical landmark matching. So what is happening? You had a skull, you had a photo, you are just matching them. You are trying to fix the image, and that too done with the help of software. Then you are going to match the bony prominences also. This is not confirmatory, never confirmatory, my dear friends. This is just a one technique. For example, a person was missing in a particular area. After 5 to 6 years, we found a skull. Now we went to the police. We asked for all the missing people in that area. So we got 10-15 photos. We tried to superimpose and we tried to guess whether this skull belong to that person or not, my dear friends. This is one of the application for this. Coming to the next thing is tattoo mark. If we talk about the tattoo mark, my dear friends, tattoo mark, tattoo dye settles in the lymph node. After death, if a body is burned completely, you can't find a tattoo on the body. But if you see the lymph node, my dear friends, on the lymph node, you are going to see the tattoo. Hence, for the identification of the dissection should be at the level of lymph node. Now, the dyes which are used in the tattoo would be what, sir? Carbon. C for carbon. P for Persian blue dye we can use. Carbon, Persian blue. Then vermilion, sindoor, malachite green, cinnabar. Carbon, Persian blue, vermilion, malachite green and cinnabar. These are the dyes used in the tattoo. For old tattoo, how you will mark? If the tattoo is faded on the body, we use the infrared rays, my dear friends. For the faded tattoo, old tattoo, infrared, faded tattoo, UV rays are used. So, I will just recollect and recall for all of you. If the person is dying, where to check the tattoo ka dye? Tattoo dye we have to check in the lymph nodes. So, after the death, the dissection should be at the till the level of lymph nodes also. The dye which is used in the tattoo would be carbon, Persian blue, vermilion, malachite green and cinnabar. For old tattoo, what you will be using? For old tattoo, we will be using the infrared rays. For the faded tattoo, we are using the UV rays, by dear friends. Now coming to the next is retina scan. Best for the biometric. For the biometry, we use the retina scan, my dear friends. Now, anthropometry or the Bartolian system. Anthropometry or the Bartolian system we talk about, discovered by the Bartolian, hence called as Bartolian system. The person was Bartolian. Identification criteria for the missing person by the body measurement and the mass. So, anthropometry, body measurement, all the structures of the body, height, weight, etc., mass, how thick the body was. So, these all are the measuring criteria we are using for the anthropometry, which was introduced by Bartolian, and the system is called as Bartolian system, my dear friends. Coming to the podogram. Podogram is a study of footprint. Study of footprint mainly used in the hospital for newborn baby to prove the exchange if happened. Moment the baby is born, we take the footprint. And for this purpose only, in the hospitals, mainly babies are getting replaced. To avoid that, we take footprint, podogram, and we compare the two foot, and we'll come to know baby is what and whose. Done. Now coming to the ninth technique is fingerprinting. Very important. Discovery was done by William Herschel. It is the best method of identification, also known as dactylography or Galton system. Also known as what, sir? Dactylography or Galton system. Start formation in 12 weeks of fetal life, intrauterine life you can say, and complete by 20 to 24 weeks of intrauterine life. So starts formation in 12 weeks of fetal life and completed by 20 to 24 weeks of intrauterine life, my dear friends. Now there is a rule which is followed right here, sir, and that rule is called as Quetelet rule. Quetelet rule says fingerprint is not same in the identical twin. What is this identical twin? Identical twins are the monozygotic twins. So their fingerprints are also not same. This was told by the Quetelet rule. Done, sir? Now type of fingerprint we are having. Visible. Number one type of fingerprint what we are having, sir? Visible. Visible impression of fingerprint by the stain. Purely by the stain will come to know the impression. Plastic. Impression of the fingerprint can be seen on soft surface only. Plastic fingerprint. Then latent, nearly invisible. Latent one is nearly invisible. We have to develop it to make it visible. We have to develop it. We will develop it with the help of different methods. Best fingerprint is left thumb, my dear friends. And permanent loss of fingerprint is seen in leprosy, radiation and charring. Now, visible, the fingerprint which is visible by stain is visible. Impression of fingerprint can be seen on a soft surface, that is plastic. Nearly invisible, we have to develop it to make it visible, that is latent, my dear friends. And best fingerprint is left thumb. Permanent loss of fingerprint is seen in leprosy, radiation and charring. Leprosy, radiation and charring, my dear friends. Done? Now coming to the different patterns of fingerprint, if we read right here, sir. Different pattern of fingerprint, number one is arch. If we see the arch, the fingerprint is like this. Like arch. Fingerprint is like this. Second is loop. You will see, is going like this from here. Yes. Then it is going like this. This is going like this, going like this, then it is going like this. So this type of fingerprint is called as loop, my dear friends. Arch, then loop, loop. Then coming to the whirl. Then coming to the whirl, my dear friends. Then coming to the whirl. Most common type of fingerprint is loop, my dear friends. Not to get angry. The most common type of fingerprint would be loop, my dear friends. Now matching and comparison of fingerprint, if we talk about first level. Level first is comparison of the pattern. We'll compare the pattern like we did just now. Then second is characteristics of the ridge. Pattern we have read just now. Level 2 is all about the characteristics of the ridge, my dear friends. Let's see what type of ridge we have. So different characteristics of the ridge we are going to read now, sir. If we see the core, this is core. If the ridge is going like this is core. Ending ridge, this is ending ridge. Then if it is not completed, just short only, then short ridge. Then fork, bifurcation of ridges like this is called as fork bifurcation. Then it is making a delta sign like this. This is delta ridge, my dear friends. Then one hook is coming like this is hook. Now is making a beautiful eye right here, sir. This is eye wala. Now this is dot or island. Dot or island like this, my dear friends. Other than that, we are having crossover. You can see crossover. Then there will be a bridge. You will see. This is bridge formation happening here. Then there will be enclosures. Then there will be enclosures like this. There will be dot and there will be a line like this. Then spicularity. Spicularity, you will see it is like a 2. It is like a 2. So these are the different type of ridge characteristics we are having, which is helpful in identifying the fingerprint. First thing what we did is finding the pattern, comparison of the pattern. Second is by the ridges, my dear friends. Now Henry classification of the fingerprint. Henry classification of fingerprint. He said there is a core, there is a delta. There is a core, there is a delta. So in arch, 0 core, 0 delta is there. In arch, what is there, sir? 0 core, 0 delta. So arch and core, delta and core you have seen. In loop type of fingerprint, there is 1 core, 1 delta. In loop, there will be 1 core, 1 delta. In whirl, there is 0 core, my dear friend. This 0 core is there. But delta, there are 2 deltas in the whirl, my dear friends. This is how we identify the fingerprints at the different levels, my dear friends. Now let's talk about the stature. Stature is all about the height. Stature is about the height discovered by Carl Pearson or Jitsing and Jitsing. Carl Pearson and Jitsing can be determined by using the long bones, my dear friend. Long bones can be determined by using the long bones. What is the formula? Formula for identifying the stature is multiplication factor into length of bone. So what are the different multiplication factors for the different bones, my dear friends? If I take right here the femur bone, there will be 3.7. For femur, it is 3.7. Tibia and fibula, it is 4.5, my dear friends. Humerus, it is 5.3. Ulna 6.1, my dear friends, and radius it is 6.5. Radius it is 6.5. So you see femur it is 3.7, tibia and fibula 4.5, humerus 5.3, ulna 6.1, radius is 6.5. So these are the different multiplication factors for the bone, my dear friends. Now we see the rule of Hasse. Rule of Hasse is this. For the first 5 months we follow the rule of Hasse. For the next 5 months we follow the rule of Morrison. What is this rule of Hasse and rule of Morrison? If you see here, for the first month the height is 1 centimeter. For the second month the height would be 2 2s are 4, then 3 3s are 9, then 4 4s are 16, then 5 5s are 25. So this is how the height is going to be for the first 5 months. 1 month 1 centimeter, 2 months 2 2s are 4 centimeter, 3 months it is 3 3s are 9 centimeter, 4 months 4 4s are 16 centimeter, and 5 5 5s are 25. Then according to the Morrison's rule, we'll shift to the Morrison's rules right now, sir. Morrison rule says 6 months, the 6 5s are 30, 7 months 7 5s are 35, 8 months 8 5s are 40, 9s are 9 5s are 45, 10s are 10 months are 50 centimeters. So at the time of birth, the height will be 50 centimeters, my dear friends. Then after birth it will become 60 in the first 3 months. Then it will become 70 in the 9 month. Then after 1 year it will become 75 centimeters. This is furthermore rule which we study in the pediatrics mainly. So 1 month 1 centimeter, very simple. 2 months 2 2s are 4 centimeter, 3 months 3 3s are 9 centimeter, 4 months 4 4s are 16 centimeter, 5 months 5 5s are 25 centimeter. For the next 5 months 6 5s are 30, 7 5s are 35, 8 5s are 40, 9 is 9 5s are 45, 10 months are 10 5s are 50. This is all you need to know in the two rules. Rule of Hasse and Morrison's rule is there. Now we will be moving on to the next, and next is what, sir? You're coming to the determination of the age by the bones. So two things are there which you need to understand. One is called as ossification, another is called as fusion. Sir, ossification is a process of bone formation. The conversion of, to be precisely if I say, the conversion of cartilage into the bone is called as ossification. Fusion is small bones, they fuse together to form a single bone. Small bones that fuse together to form a single bone, that is called as fusion. Now ossification center in the intrauterine life. When the baby is inside the uterus, intrauterine life is going on, then ossification center appears when that cartilage will be converted into bone. So important ones we'll learn right now, sir. First ossification center, clavicle, 5 to 6 weeks. And clavicle, if I tell you, the most common bone to get fracture in a body would be clavicle only, my dear friends. 7 months, S for 7, S, sternum and talus. The ossification center for the sternum and talus would be at 7 months. 9 month lower end of femur and 10 month upper end of tibia. How beautifully? If I say this is femur, this is knee joint, this is tibia. So see, sir, 9 month there will be lower end of femur and 10 month there will be upper end of tibia. 10 month there will be upper end of tibia. So these are the ossification centers. We'll be revising once more. First ossification center appeared for the clavicle at what intrauterine life age, my dear friends? 5 to 6 weeks. 7 month it is sternum and talus. 9 month lower end of femur and 10 month it is upper end of tibia, my dear friends. Now we coming to the bone fusion. Bone fusion, that means small parts of bone are together fused to form a single alone bone, my dear friends. Like patella at 14 years. Small bones will fuse together to form a patella at the age of 14 years, my dear friends. If I talk about the xiphoid bone is here, sir. Xiphoid, 40 years, sir. Now, sir, upper end of humerus and lower end of humerus. Upper end of humerus is 18. If you just subtract 2 from it, it will be 16. The lower end would be the 16, my dear friends. So, upper end at 18 years and lower end humerus would be the 16 years, my dear friends. Now, upper end of radius and ulna at 16 and lower end of radius and ulna is 18. How beautiful it is, sir. If I draw like this, a boy like this, sir, you'll better understand like this. If this is a humerus, we see the upper end of humerus by 18, lower end of humerus by 16. If we see radius and ulna, my dear friends, the upper end is by 16 and the lower end is by 18, my dear friends. Lower end is by 18. So 18, 16, 16, 18. Now, upper end of femur 16 years. Upper end of femur would be 16 years. Upper end of tibia and fibula 18 years, my dear friends. The fusion will happen at 18 years. Lower end of tibia and fibula 16 years. Lower end of tibia and fibula, it is 16 years. So if I draw a leg like this, my dear friends, this is knee. You will see upper end of femur 16, upper end of tibia and fibula, it is 18, lower end of tibia and fibula, it is 16. Again, it is 16, 18 and 16. 16, 18 and 16. 16, 18 and 16, my dear friends. Now we are coming for the skull. Skull suture fusion. The number one suture which is getting fused would be metopic suture. The first suture which is getting fused together would be what, sir? Metopic suture. Then there will be lamboid suture at 45 years. Then coronal and sagittal 25 to 30 years of age. This is best suture for the age estimation. Someone asks you which is the best suture for remembering the age estimation. Your answer would be what, sir? Coronal and sagittal sutures. Coming to the next diagram, if we see right here, sir. So you will see right here, sir. If you see right here, sir, this is front face. If I draw a nose like this, eyes here. So you will see ears here. So you will see the skull right here. So number one thing is what, sir? Metopic suture right here. This is metopic suture. And we have seen right now metopic suture, they are getting fused first, my dear friends. First suture at the time of birth. They are getting fused. They are closing. After that, there will be a coronal and sagittal suture. Coronal and sagittal suture, they are getting fused at 25 to 30 years. Coronal and sagittal 25 to 30. 25 to 30 years. Then coming to the last, lamboid suture. Lamboid suture 45 years. 45 years. So these are the different suture we have learned right now, sir. Now anterior fontanelle, this part, sir. Anterior fontanelle is this. The anterior fontanelle is getting close at 18 months, my dear friends. The anterior fontanelle, when it is getting close at 18 months. Posterior fontanelle, this is posterior fontanelle at the closes at the time of birth. Anterior fontanelle 18, anterior 18, posterior as closes at the time of birth itself, my dear friends. Mandible fuse, yes, this is mandible, the jawline, the beautiful jawline coming here. Mandible fuse at 2 years of age. Mandible fuse at 2 years of age. Terion fuse, this part is terion. This part is called as terion. My dear friends, fuses at 65 years of the age. Hyoid bone fuses at 40 to 60 years of age. Sacrum bone, my dear friends, sacrum bone 21 to 25 years of age. So different ages we have learned of the bone fusion. Now the next topic what we have to start right is race. Which race? Indian, Chinese, African? This is race. So for that we need to understand about the cephalic index. The concept of cephalic index, my dear friends. If we see right here cephalic index, breadth of skull upon length of skull into 100 will give us a certain value. Before that, I just want to show you the table, cephalic index ka table, and then we'll be learning about the different skull, type of skull. So if we divide this into three categories about the cephalic index, 70 to 74.9, then 75 to 79.9, and then 80 to 85. So moreover, we'll see like this 70 to 75, 75 to 80, 80 to 85, just to make it simple. Otherwise, it is 70 to 74.9, which is round off value 75, then 75 to 79.5, and 9, that is round off value of 80, then 80 to 85, my dear friends. Done? Now, my dear friends, we see like this type of skull, dolichocephalic. If the cephalic index is between 70 to 75, we consider that as dolichocephalic skull. And dolichocephalic, guys, remember D for dark. Who are dark? Nigerians, Negro and Aryans. So it is seen in Negro and Aryans, my dear friends. Then coming to the 70 to 79.9, 75 to 79.9, mesaticephalic. Mesaticephalic, it is seen in Indian and Chinese. 80 to 85, brachycephalic, it is seen in the Mongols, my dear friends. We see right here, sir. Dolichocephalic, dark, it is seen in the Negro plus Aryans. Mesaticephalic, cephalic index is between 75 to 80, my dear friends. This is seen in the Indian plus Chinese. Then brachycephalic, more than 80, it is seen in the Mongols. It is seen in the Mongols. It is seen in the Mongols, my dear friends. So this is how we have learned. Now, brachial index is something right there, sir. What is the formula of brachial index? Remember, length of radius upon length of the humerus multiplied by 100. This will give us a brachial index. Now, sir, crural index. Crural index, length of tibia upon length of humerus into 100. It will give us crural index. Now, sex differentiation. The next thing we need to learn right here, sex differentiation by the primary sexual characteristics and the chromatin study. In chromatin study, two important bodies are there, Barr body and Davidson body. Barr and the Davidson bodies, where they are found? They are found in the female gender. In the female only it is found, my dear friends. If they are absent, that means the body is of male. If they are present, that means the body is of a female, my dear friends. Now let's see the difference. Barr body. You will see Barr body and Davidson body. Let's see this. Barr body, Davidson body, they are seen in the female, my dear friends. You will see in the Barr body, inactivated X chromosome seen as condensed mass in nucleus. Inactivated X chromosome seen as condensed mass in nucleus. Condensed mass in the nucleus, my dear friends. Condensed mass in the nucleus. You will see X chromosome, inactivated X chromosome, condensed mass. This is Barr body. This is Barr body. Condensed mass in the nucleus, my dear friends. If you see the Davidson body seen as drumstick body, there is an additional lobe. You will see seen as drumstick body. Drumstick body. What is present there? Additional lobe like this would be present, my dear friends. Other than that, you will see which is most commonly seen in the female. This Barr body is most commonly seen in the female. Might can be found in the male. Least chances are there. But if I talk about the Davidson body, it is only seen in the female. Most common site of sample, sir, buccal mucosa, hair follicle. And if we talk about the Davidson body, blood smear we take, sir. Coming to the most common cell is somatic cell, my dear. Somatic cell. And for the Davidson body, most common cell is neutrophil. You can see right here, sir, neutrophil. Extra lobes are present in the neutrophils. So this is a basic difference we have learned right now about the Barr body and the Davidson body, my dear friends. Now we talk about something called as fuel gene reaction. Fuel gene reaction we see to assess the X chromosome, and X chromosome is present in the females. The reagent used is acrylflavin and quinarsin reaction, guys, remember, to assess the Y chromosome. Fuel gene reaction is to assess the X chromosome and quinarsin reaction is for the Y chromosome. Reagent used in quinacridine hydrochloride. So these are the two reagents for the X chromosome and the Y chromosome. We need to remember right here, sir. Now we have to differentiate two things. Male versus the female bone, and the best bone would be what, sir, here? The pelvic bone. That we'll discuss separately. But here we have to differentiate male versus female bone as a wholesome, my dear friend. So in general, whose bone is more heavy? The male bone is large and heavy, female is small and lighter. The bone weight is lighter as compared to the male bone, my dear friends. For the head is sloping. For the male, head is sloping, But the female head is vertical, my dear friends. Head is vertical. Sloping type of head is seen in the male like this. In the female, it is vertical, standing. Bony prominences. In the male, bones are more prominent except frontal and the parietal eminences. All the bones are prominent except the frontal and the parietal. Frontal and the parietal eminences. In the female, frontal and the prominent eminence, the parietal eminence, we say it parietal, just a spelling mistake, parietal eminence are prominent in female. The frontal and parietal are prominent in the female, my dear friends. If we talk about the chin and the orbit, chin and the orbit, in the male it is squared, but in the female it is round. Female cheeks are round, my dear friends, round. Length of sternum by the Ashley's rule, my dear friends, more than 149 millimeters. The length of sternum according to the Ashley's rule is more than 149 millimeter, and if it is less than 149 millimeters, we consider that as female bone. Now, other appearance guys, in the male, from the mandible. Now we have to discuss about the mandible. According to the mandible, appearance in the male is large and prominent. In the female, it is small. Chin, if we talk about, it is square shaped chin is there. And in female, it is round, my dear friends. In female, the chin is round, my dear friends. Appearance of the male it is large, prominent, female small. Chin is square shape in the males, and in female it is round. Then angle body of a ramus angle body less than 129. In female it is more than 129, my dear friends. Now, male versus female pelvis, my dear friends. Best bone for the sex determination is what, sir? Your pelvis. If we see the pelvis, best bone for the sex determination is pelvis, my dear friends. So let's differentiate pelvis. First of all, let's differentiate the shape of pelvis, my dear friends. In the male, it is triangular shape. Female, it is square shape. Pelvic inlet of a male is heart shape. That doesn't mean heart of male is in the pelvis. No, not at all. Pelvic inlet, heart shape, and the female, it is circular, my dear friends. Greater sciatic notch is the best parameter to differentiate male and female pelvis, my dear friends. Greater sciatic notch is narrow and deeper in the males, and it is wide and shallow in the females, my dear friends. Subpubic angle, if we see, it is 70 to 80 degree, and in the female it is 80 to 90 degree, my dear friends. Moreover, if I say less than 90 degree is male and 90 to more than 90 degree it is female. Sciatic notch index, my dear friends, 4 to 5 in male, 5 to 6 in the female. Obturator foramen, my dear friends, it is oval shape in the male and triangular in the female. And if I talk about the subacute angle is of V shape because it is less than 90 degree. And my dear friends, in the female, because more than 90 degree, it moreover look like a U. Pelvic cavity conical and funnel shape, but in female it is smooth and round. Let's see the diagram. You will see the pubic arch 60 to 70 degree, which look like a V. And here in the female pelvis, you will see it is more than 80-90 degrees. That is why it is looking like a U. The inlet of female is what, sir? Your round, and male pelvis, it is heart shape. Greater sciatic notch, you will see in the female it is wide like this. In the male it is narrow like this, my dear friends. You will see the female pelvis is wider as compared to the male pelvis. So these are some differentiation factors you need to learn right here, sir. So these are the important differentiation factors you need to learn right here, sir. Now coming to the Krogman's accuracy. What is Krogman's accuracy? Accuracy of a sex determination from the body. Guys, pelvis, if we talk about, pelvis is giving us 95% accuracy. That is why pelvis is best in the adults. But if compared to the skull, skull is better in the children, and the skull is giving 90% accuracy. Long bones, for example, humerus, femur, sternum, etc., they are giving the 80% of the accuracy. And complete skeleton, if we will compare both the skeletals completely, my dear friends, we are getting 100% accuracy. So these things are very, very important right here, sir. Now we'll talk about the ciliatic index. Pelvic part is equal to the pelvic part is more prominent in the female, and sacral part is more prominent in the male. Ciliatic index, if we talk about, sacral part upon pelvic part into 100. In male, it is more, my dear friend. So ciliatic index is more in male as compared to the female, my dear friends. Now coming to the Hightel law. Hightel law says in male, the body of the sternum is longer and more than twice the length of the manubrium. In males, the body of sternum is longer and more than twice the length of the manubrium. If manubrium is this much, the male sternum will be this much, my dear friends. Second, he says in female, the body of the sternum is shorter and less than twice the length of manubrium. In female, the body of sternum is shorter sternum is there, and less than twice the length of manubrium. Twice length of manubrium, that means half sternum would be there. So this is Hightel's rules, my dear friends. Thank you so much.